And aloha, everyone. Welcome to our August Speaking of Health lecture series. My name is Eric Barsatan, and I'm the manager for Physician Relations and Medical Staff Services here at the Queen's Medical Center, West Oahu. Today, speaking of health, the topic is prevention of falls in the elderly. And our speaker's presentation today is entitled Gait, Balance, and Falls. Right now, enjoy the presentation. If you could ask all of our viewers to be on mute. If you have any questions, please type your questions in the chat box, and our speaker will answer them at the end of his presentation. We know that this is a very important topic for many of you, so please don't hesitate to type your questions in the chat box. At this time, I am honored and privileged to introduce our speaker, Jordan Fukumoto. Jordan was born and raised on Oahu, graduated from St. Louis High School, and attended Pacific University for his undergrad and doctorate of their physical therapy program. His hobbies include golfing, reading, hiking, and spending time with his family. Welcome, Jordan. You now may proceed with your presentation.
All right, good evening or good afternoon, everybody. My name is Jordan, and for the next about 45 minutes, we'll be going over gait, balance, and falls. So here's a brief outline of my presentation. So 6 talking points, going over the facts about falls. Number 2, the consequences of falls. 3, the factors related to falls. 4 is going to be a fall checklist. 5 will be assessing our balance and fall risk. And 6, different things to improve your balance. So first off, what is the definition of a fall? So the definition of a fall is a sudden involuntary transfer of the body to the ground and at a lower level than the previous one. So basically just slipping, falling, lowering yourself to a different surface unintentionally. So facts about falls. So every 20 minutes, an older adult dies from a fall. 1 in 4 older Americans fall every single year. So consequence of that is 2 times more likely. So older adults who have fallen have twice the chance of falling again. 1 in 5 falls result in head injury or broken bones. And it definitely adds up as far as just the amount of care and cost for medical coverage. So $744 million for that. Once again, so these are the top 10 causes of death among older adults. So number 1, heart disease, as you make your way down the list. Number 7 is unintentional injury. And as you break down that category, the top 3 causes of unintentional injury death, number 1 is falls. So the big consequence of that too is that fewer adults are speaking to someone regarding medications and fall risk. So that can be a big concern. So the example, they did a study and in the past 12 months, so they asked participants who you have talked to about medications that might make you fall. So out of 4 categories, so 82% of participants said that they haven't talked to anyone. 15% said that they talked to their doctor. 8% stated that they talked to other healthcare providers, including pharmacists. And 3% talked to other family or caregivers. Now, take into consideration that it leads up to more than 100% because participants could select more than one source. All right, so all adults age 65 and older are at a risk for falling. Older adults are likely to fall, especially including females, those over 85, and older, especially American Indian and Alaskan Natives. So if you take a look at the chart, so if you look from left to right, falls related to sex are by sex. So females are just slightly more likely to fall. I think a big reason on that is because the actual the age range for men versus women is a little higher for women to be a lot older. Falls increase with age, so as you get towards that 85-year-old threshold, that's when you're at a kind of 1 in 3% chance of falling. Falls vary by race and ethnicity. So luckily for us Pacific Islanders, Asians, people of Hawaii, we do a good job, 16%, which is really good compared to, if you look at the Hispanic, white, and Native Indian, Alaskan Native, a little bit higher risk for falling. So some of the consequences related to falls, a big one is a loss of independence. Very crucial. I mean, I wish that I could highlight that more. Independence is a very significant part of living. Being able to do everything that you want to do. If you're the person, if you're the caregiver, if you're the family member, independence is an important part to being able to just do everyday activities such as going to the bathroom, showering, even simple as just putting on clothes. An increased risk of hospitalization, so falling can lead to a lot of injuries and other things. Prolonged recovery increases healthcare costs. Immobility, so hip fractures, head injuries, significant factor on that. This can lead to an increased mortality. So the 1 year mortality rate after a hip fracture, so if you're to fall and fracture your hip, the hip mortality or the mortality rate would be about 14 to 58%. So that's a pretty wide range. And the reason being is because when you're fracturing your hip, the consequence is you're not able to move as much. So that can lead to being inside. You can be bedridden, hospital stays, subacute care, skilled nursing facilities, and the quality of life significantly declines, which leads to a downhill spiral on things. So that's the big wide range between the 14 and 58%, especially when participants or patients have fallen in the past. That can definitely lead to a increased risk for that. So some of the factors related to balance and falls. So two different factors. You have the intrinsic or the individual. So those are things within your body that you can control. And then there's the extrinsic or the environmental. So if we take a look at the intrinsic or the individual changes that happen and are related to falls. So as we age, visual changes that can occur. So a big change that can occur is that ultimately, if you think about going from a very lit versus a very dark room, that can definitely change your balance and it can make you feel a little bit more unsteady. The example that we use is when you're getting up in the middle of the night, very dark. So light is very important because if it's dark, it can lead to a lot of different changes and risk for falling. Muscular changes, I'll explain that in the next slide. Range of motion and posture can definitely increase your risk for falls because ultimately, instead of being a nice straight posture, things can start to curve, it can start to bend and be a little bit stiffer, which makes your range of motion a lot tighter and more less opportunities to catch yourself when you are tripping or falling. Orthostatic hypotension, that's just a fancy word for saying that your blood pressure changes as you change from different positions. So an example of this is when you're laying down, then you sit back up or stand back up. So as you're changing from one position to another, you might feel a little bit lightheaded. And the big reason in that is because your blood pressure changes as you're going from a more laying down position or a flat position to a more vertical position. So it takes your body a little bit more time to get that blood pressure from down here to being able to stand and going against gravity to get it towards your head. So making sure that you're taking a second to allow your body to recover, allow your body to get back into it, and going safely after that. Cognitive or dual tasking. So a big thing on that is as we're walking, as we're going up and down stairs, as we're doing different things, making sure that we can do multiple things at the same time. A lot of times we don't just hyper-focus on what we're doing. We're doing multiple things such as talking, such as carrying things. So as you're doing multiple things, you can tend to forget about where your foot is being placed, whether you're doing something that might increase your risk of falling. The other change that can occur is fear of falling. So if you've fallen once, you're 2 times more likely to fall again. And the fear of falling can lead to a more sedentary lifestyle. You don't want to move as much. It can lead to a lot of different consequences because you're not going to be doing as much. Then you start to be more dependent on other things. People, family members, caregivers start to assist you more. And then that can lead to just a loss of independence. And then the final one is medications. So certain medications can combine to lead to different kind of risks of falling. It can make you feel dizzy, it can change your blood pressure, it can make you basically change how you're moving. So an important factor on that is talking to your doctor, your pharmacist, your medical provider, talking and discussing if you are having side effects from your medications, because that can be a very big reason why people fall. And as we go to the right-hand category, so the extrinsic or environmental factors, so these can be things outside of our body that are in around the environment around us. So whether that's in your house, outside, could be your cat, could be your dog, could be pets. So these are obstacles and tripping hazards. These are other things such as lack of handrails, so going up and down stairs, going up and down a curb, in and out of your shower, up and down from your toilet. Certain things can lead to either an increase or a decreased risk of falling. A lack of bathroom grab bars, lighting, as I said, changes within your vision can definitely occur, so lighting is an important factor. Slippery surfaces, making sure that you're cleaning up the ground. If you spill something, making sure that we're cleaning that up so that way you're not going to be tripping on that or slipping on it as you're going through your everyday life. And the final one is improper use of your assisted device. So whether you're using a cane, a walker, wheelchair, whatever that may be, making sure that you're using it properly, because if you're not, then that can lead to just more tripping hazards, especially when you're turning, especially when you're transferring from either surface A to surface B, such as your wheelchair to your bed, or from your toilet to your wheelchair. So going back to the muscle strengthening, muscle power. So as we age, there is a 1 to 5% loss per year after the age of 30. So 30 seems to be the peak amount of time until you reach the optimal strengthening. As we hit 30, there's a steady decline in the amount of muscle strength that you have. So ultimately, weight training is important because it's almost an uphill battle, which is why recovery time seems a little bit longer as we get older. We're naturally going against our own progression of time, and strength can definitely be an important factor on that. So this could result in a 50 to 70% loss by the age of 70, just because if you add in the cumulative effect of not doing exercises, not moving, and having that steady decline in your strength can definitely affect how you're moving, what you're doing, and the strategies that you can do or not do to recover from falling. Muscle power. So muscle power is basically just the ability to react and move. This can lead to a 3 to 5% loss per year, which can be a significant factor. So muscle power, when I think of power, I think of speed as well. As you trip, first off, let's say that you're walking down, you trip over something, you got to have the strength and the speed in order to put your foot in a position or put your hand in position to recover from that fall. And making sure that we have the adequate ability to do so is very important. So this is just a flow chart that kind of just talks about the same thing. Sarcopenia is essentially just the muscle loss that we get as we age. So it's a natural progression. Everybody goes through it. So this can lead to a decrease in strength, a decrease in power, and a decrease in muscle endurance. So as we go down, a decrease in strength can make it a lot difficult to do weight-bearing things. So weight-bearing on your feet, standing, cooking, cleaning, whatever that may be on your feet. Decreased power, so increased risk of falls and fractures. Muscle endurance, so increased fatigue and exercise difficulty. So as you get fatigued a lot quicker, this can lead to a lot of bad habits that can occur. Compensations can occur, and then that can lead to decreased physical activity as well as disability. And something that I wish I had in here as well is just a decrease in independence. So other factors, this was in the metric system, so I try to convert it as best as I could. So curb heights, so some factors that we kind of don't think about, which they do metrics and studies on. So curb heights are typically about, for us, 6 to 7 inches. So being able to get our foot 6 to 7 inches is very important to get up and down a curb. So if you were to stand up, you got to be able to get your foot 6 to 7 inches off the ground in order for you to get up and down the curb. If you have the strength, range of motion in order to do that, as well as the strength to actually propel yourself up forward. Crosswalks, so they design crosswalks as well as just the the length of time. So if you're ever sitting in traffic and you're wondering why or how they actually make the numbers to determine how long the crosswalk is on, they base it off of a certain velocity. That is about 0.74 to 1.05 meters per second, or in our terms, 1.6 to 2.3 miles per hour. What that basically looks like is being able to cross from one point of the street to the other, being able to do that in the amount of time from when the green light starts till it actually the hand stops blinking and those numbers are no longer there. So if you're able to do that properly within the time, then that's typically a good indicator that you are able to walk in the community with good speed without having as much of a risk of falling. So other distances, so getting around the post office, so 30 to 60 meters. Throughout the bank, 51 to 64, and the big one is a supermarket. So this is typically a smaller supermarket, so 230 to 340 meters. So if we think of that compared to miles, so about 400 meters is a quarter mile. Let's say that you're going to Costco or a bigger warehouse. Typically, those range from about a quarter to half a mile in order to be able to go around the store, in and out through different aisles, and being able to do that. Quarter mile should take, if you're going on the street and you're just doing a regular walking program, if you're wanting to stay within these velocities right here, as well as within these ranges of the supermarket, if you are to walk a quarter mile and you're maintaining these speeds, that typically is about a 6-minute mile, or 6-minute quarter mile. So here's our fall checklist. So I'll go through this with you guys again. I blew it up a little bit bigger on the next slide. So this is kind of just a fall checklist. So on the left column, you have yes, no. They add into certain points, different questions, why it matters. As you go through this checklist, you're able to get a total score. Add up the number of total points for the yes answers. If you scored more than 4 points, then you may be at risk for falling. So this is just a quick checklist, and then we'll talk more about different assessments that we can do, preferably with someone that is trained at fall assessments. But if you do feel like you're ready for that, then that's totally up to you. So here it is on the top. So here is the first 6 questions. So click yes or no for each statement. Yes or no, I have fallen in the past year. Yes or no, I use or have been advised to use a cane or walker to get around safely. Yes or no, sometimes I feel unsteady when I am walking. Yes or no, I steady myself by holding onto furniture when walking at home. Yes or no, I am worried about falling. Yes or no, I need to push up with my hands to stand up from a chair. Okay, the next checklist, so the bottom half, the last 6 questions. Yes or no, I have trouble stepping up onto a curb. Yes or no, I often have to feel rushed to the toilet. Yes or no, I have lost some feeling in my feet. Yes or no, I take medication that sometimes makes me feel lightheaded or more tired than usual. Yes or no, I take medication to help me sleep or improve my mood. And yes or no, I often feel sad or depressed. So this is just a quick checklist to kind of talk about, once again, if you are or are not at risk for falling. If you answered no to all of them, then the chances are that you may be less likely. It doesn't mean that you are or are not, but you may be less likely to fall. So here are the physical things that we do. So these are physical assessments that assess your balance and your fall risk. So 3 different ones that we typically do. There's the timed up and go test, the 5 times sit to stand test, and the 4-step balance test. And I'll go through each of them. So here's the timed up and go test. So what this is basically you start off on top of the seat, or you're sitting down. You need a chair and a stopwatch for this. We stand up from the chair, walk 3 meters or about 10 feet around either a cone or line, all the way around, and take a seat down. So that's the timed up and go test. Once again, taking a seat on top of this chair, ready, set, go, standing up, walking around, and taking a seat all the way back down. So time will stop once you sit back down. So here are the age-related norms. So between the ages of 60 to 69, the average individual would walk around 8.1 seconds. Here between the ages of 70 to 79, 9.2 seconds, and 80 to 99 is 11.3 seconds. So here are the cutoff scores, predictive of falls. So if you're a community dwelling, frail, older adult, a lot of adjectives on that, greater than 14 seconds associated with a higher fall risk. Post-op hip fractures at the time of discharge, greater than 24 seconds of falls within the 6 months after hip fracture. And frail adults, greater than 30 seconds is predictive of requiring assisted devices for ambulation and being dependent on your activities of daily living, so just everyday activities. Now, just to kind of talk about this once again, this one has it without any kind of assisted device. Going back to this slide over here, greater than 30 seconds, so if you're not using any kind of cane, walker, this is just predictive if you probably do need one, if that's the case. Now, when you are doing this test, you can use your assisted device, whether that's your cane, your walker, hemi walker, whatever that may be, just making sure that we're safe when we're doing this. So the next test is a 30-second sit-to-stand test. This test to see how strong you are in your legs. So how we administer this is you start off on the very left-hand side, your hands are across your chest, seat is about 17 inches off the ground, so your typical standard chair will do standing up, extending your legs, sitting back down, and that would be 1 rep. So 30 seconds, how many reps are you able to take a seat, stand back up, sit back down within that 30-second interval, making sure that you're not using the back of your legs to push yourself up, nor are you using your hands to push yourself up. So within 30 seconds, how many repetitions are you able to do? So here are the norms. I have one for men, one for women. So if we look over here, 60 to 64, below average is less than 14 reps within 30 seconds. An average individual between the ages of 60 to 64 is 14 to 19 repetitions, and above average is greater than 19 repetitions. So you can take a look at a category that maybe you, a family member, a loved one is in, and you can kind of get an idea of how many repetitions that you can do within 30 seconds. There's men, and here are the women. Same thing, below average, less than 12 reps. Average would be 12 to 17, and above average is 17 repetitions. So if you're able to do this safely, securely, obviously, is an important thing. A lot of these tests, like I mentioned, I wouldn't recommend necessarily doing it on your own, especially if you're at a risk for falling. So the final test that we do is the 4-stage balance test. So in order to do this, you have 4 different stages. Now these are in sequence from 1 to 4, so you can't just get from 1 to 4. You have to go through each one. I think the cutoff score is about 30 seconds until you complete that stage. So the first one is standing with your feet side by side. So recording that time. If you're unable to do more than 30 seconds, then you aren't able to get on to the next one. So number 2, placing the instep of 1 foot so that it's touching the big toe of your other foot. 30 seconds again. Number 3, placing 1 foot in front of the other, heel touching toe. And then the final one is standing on 1 foot. So as you're going through this, if you're able to go from 1 through 4, the cutoff right here on the very bottom, an older adult who cannot hold the tandem stance for at least 10 seconds is at an increased risk of falling. And the tandem stance is number 3 right over here. A big thing with this is as we're going, so as you're doing number 1, okay, good, we're doing that. We're able to do it for 30 seconds. You go on to number 2, making sure that you're not using your hands in order for you to get from feet here to feet there. That would be considered cheating, and nobody likes a cheater. All right, so a little bit busy slide over here. This goes back to the standing on 1 foot. So if you are able to stand on 1 foot, then there's different age-related norms. So the biggest thing to look at, I know it can be a little busy right now, but between the ages of 18 to 38. So if you look in the left-hand column right over here, if you're between the ages of 18 to 38, if you were to do this 3 times, if you're a female, you can do it 45 seconds. If you're a male, you can do it 44.4 seconds, and the total is just 44.7. So this is the average, or sorry, this is the best of 3 trials. So if you were to do this 3 times, all right, stand on 1 foot, okay, next time again, stand on 1 foot, do that 3 times, you'd be able to do that for about 45 seconds. That would be the average for the best score. Now, as you go down the chart, 40 to 49, if you're a female, if you're a male, here's the best score that you'd be able to do, 50 to 59, 60 to 69 on the next row, 70 to 79, 80 to 89. The last row, that's just a total from their study. So we take a look at this and you want to see where you stand as far as how you go up against certain people around your age. These are good norms to kind of look at to make sure that we can kind of just test to see what the normal is and whether or not we are maybe a little bit less average or above the norm. It's always a good kind of litmus test to kind of see where we're at, especially if we go back to the previous 4-stage balance test and if we're able to do all those things. So this is a more challenging version of that. Good. So how to improve your balance. So big 4 things: speak up, especially to your doctor, to your therapist, to your healthcare provider, to your family members about what's going on, especially if you're at a risk for falling. Keep moving, keep moving, keep moving. Can't emphasize this. Making sure that you're moving as well as being safe. Check your eyes. Vision changes can occur, and make your home safe. So these are quick little checklist to talk about certain things that you can do on your own. So stairs, always make sure that there's certain things that you can take a look at. Are there paper, shoes, books? Are there bumps or uneven surfaces? Fix it. Light switches. Does your stairway have a light bulb? Is it burnt out? Is the carpet on your steps loose or torn? Making sure that you can change that. Are the handrails loose or broken down? So making sure that all these different factors within our house, within our environment is in a point that can lead to success rather than failure. So the floors, when you're walking through a room, do you have things to walk around on? Do you have throw rugs? Are there paper, shoes, books, or other objects on the floor? Do you have to walk around or over wires, especially cords? In the kitchen, are there things that are on higher shelves? If so, bring it to lower shelves. Make it easier to grab. Is your stool step sturdy? Is bedrooms, is there light near the bed? Is it dark path from your bed to your bathroom? Bathrooms, is it slippery? Do you need some support getting in and out of the tub or toilet, such as those? So the physical parts of how to improve your balance. So aerobic exercises, so that's just generally walking, strengthening exercises, balance exercises. Tai Chi has been a very good proven recommendation for improving balance. And the final one is this Otego program, which we'll talk about and go through. Basically, it's just a structured program that can show you how to improve your balance. Fall prevention, very important because these exercises can lead to a decrease in injuries by 37%, serious injuries by 43%, and broken bones by 61%. Exercises, those lead to stronger muscles, stronger bones, quicker reaction time, improved coordination, decreased pain, improved health and function, and the big one again, independence. So here's the breakdown of the Otego exercise program. So broken down into the strengthening, balance, and walking program. So the intensity of the strengthening program should be about 8 to 10 reps before fatigue. The length is about 30 minutes, 3 times a week, with the rest day in between. And the tips, making sure that you have correct breathing technique. So inhaling, exhaling on exertion. So if you're doing a standing up exercise, if you're squatting down, inhaling, exhaling on the way back up. Perform the exercises slowly. 1 to 2 minutes rest between sets to allow adequate recovery time so that way you're not overworking yourself. So this is just a quick little depiction of what you'll be able to do. So these are some pictures that show just some of the exercises that you'd be doing. So straightening out the legs, standing, putting one foot in front of the other for balancing, sidestepping, doing little squats to help out with your leg exercises, walking in a figure eight in order to help out with turning. So I did have a YouTube video, but unfortunately I can't show it to you because of the way that this presentation is set up. So the Otago exercise program, so you start off with the warm-up flexibility exercises. So these are head movements. Basically what you're going to be doing is rotating your neck side to side, tucking your chin to help out with posture. So that'll be for the head, the trunk movements, rotating, and going up from those. So these neck movements, stand tall 5 times, ankle movements, back extensions. So these exercises are built to help out with your flexibility. So the strengthening exercises, so knee extensors. So basically what you're going to be doing with these ones are taking a seat, straightening out your leg one at a time. Knee flexors, you're going to be standing, bending your knee, making sure you're activating the backside of your hamstring muscle. Your hip abductors, so standing up, straightening out your leg to the side. Calf raises, toe raises, going up on your toes, going up on your heels. So this is built from left to right, all 4 levels, level C and level D. Basically what it's talking about as you're going from level A to B to C to D, it just increases in the intensity and the vigor of that. So in order to go from one level to the next, being able to do 2 sets of 10 before you progress. For the calf and toe raises, 10 repetitions, that'll be holding on with support. And as you get better, no support. That will definitely improve your strength off of that. So balance training, so the intensity, being able to do that without supervision. So as you go from being supervised, that's going to be a more easier version with the goal of being able to do that without supervision. So the length of these sessions are 30 minutes for 3 times a week. And some of the tips are making sure that your eyes are looking forward, recovering using your lower body versus grabbing with your arms. So what that means is if you feel like you're going to fall, using your foot, using your leg to step and recover from your balance rather than just trying to grab on with your hand, because sometimes there's not always going to be something that you can grab onto, so you don't want to rely on that. So once again, it's okay to make adjustments such as recovery step, because you definitely don't want to do these exercises and increase your risk or actually fall during this. So this goes again from level A to level B to level C to level D, level A being the easiest. So these knee bends, these are standing up, basically doing mini squats off of that. So holding on for support, that'll be an easier version. As you go on to level B, 10 repetitions, no support. Level C, 10 repetitions, no support, and repeat. And level D, 10 repetitions 3 times, so increasing the amount of sets. Backwards walking. So the biggest thing with these balance exercises, having a grab rail next to you or a counter, especially a longer counter, can definitely be helpful because then you can put your hand on top of the counter if you need the support, with the goal being no support. So backwards walking, hold support, no support as you get better. Walking and turning, so that's the figure 8. You need to use your assisted device, whether that's your cane, walker, whatever that may be. So level B, doing that without your doing that with your walking aid, to level C, doing that without. Sideward stepping, so same thing, then 10 steps to the right, back and forth 4 times using your walking aid or assisted device, or using the counter for support, or a long railing if you need be. Tandem stance, so tandem stance is 1 foot in front of the other, left foot, right foot, 1 foot in front of the other, or right foot, left foot in front of the other. Tandem walking, right foot, left foot, making sure that you're stepping 1 foot in front of the other. That'll definitely be a lot harder than actually standing there and just being supported. One leg stand, so that goes back to the staying on 1 foot, at 2 feet, lifting 1 leg up, making sure that you're not pressing your foot onto your other leg or holding on if you're trying to get better at it. Heel walking, so being on your feet, lifting your toes up and walking on top of your heels, and vice versa with the toe walking, being on your feet, lifting up your toes, or lifting up your heels and walking forward. And then heel toe backward walking, walking backwards, with that being the hardest challenge for this program. sit to stand. This goes back to the strengthening as well as the balance, being able to do that. So use your arms for support if you're unable to do so, with the goal of being able to do it without any kind of support. And then stair walking as instructed. So once again, these are all kind of exercises that we provide as therapists, as a healthcare profession. I certainly don't recommend doing it at your own pace, just because you need someone there to guide you through this. This is all meant for you to see a therapist first in order for you to get to a point where you can do it on your own. And then the final part of this is the walking program. So the intensity, walk at your usual pace with the usual walking aid, progression being able to walk indoors, to advancing to being able to walk outdoors. Outdoors can have a little bit different surface, whether that's flat ground versus unsteady pavement versus grass. So all these different things relate to being able to be more mobile and being able to go out in the community and being on your own. So the length of these sessions, 30 minutes, can be at least 2 times a week, and these can be broken up into shorter intervals, such as 10 minutes, 3 times a day. So finally, this is just a quick little chart that shows just an example calendar. So this is your Sunday to Saturday calendar. So let's say Sunday, walk 15 minutes, with the goal being 30 minutes. You do your exercise program on Monday, walk for 10 minutes. Tuesday, take a break. Wednesday, do your exercises again. Thursday, do your exercises as well as your balance training, walk around the park for about 15 minutes. Friday, exercises. Saturday, exercises and walk for 10 minutes. So this kind of gives you a framework to space out, come up with a plan. One of the big things that we talk about, especially in therapy, is consistency rather than intensity. Being consistent day to day, doing small little chunks here and there, rather than just trying to do it all at one time. So that intensity where you're going up and down and you're trying to do everything at one time can lead to more of a burnout, as well as just fatigue and more challenges than it does bring success. So if you're able to do this more consistently throughout the day as well as throughout the week, that leads to a lot better just overall results rather than just trying to do it all at one time. So I'd like to thank you guys for participating, for being here, for just taking this opportunity to learn more about balance, falls, and whatnot. I wish that I can, be there for all you guys and, really help out individually, but obviously this has to be the last part of it. So if anybody has any questions, I'll be here to answer any of them right now as well as in the future too.
Thank you very much, Jordan, for the great presentation. We sure learned a lot today, really helpful information. Yes, if any of you have any questions, if you can please write them in the chat box at this time. No questions. Jordan, just a quick question for you. Where would you recommend people to buy like a gait belt or any supplies related to, fall prevention?
Yeah, so that will be specific to where you are as far as your balance and fall risk. Now, typically the assisted device, whether that's your cane, your walker, typically we can go through a certain program, or we can have you checked out, whether that's in the hospital or at therapy for that. Certain things that definitely help out with, with fall risk or helping out with your balance. Gait belts are important because if you have someone that can be there for support, if you're a caregiver, a gait belt is basically just a walking belt. So think of it like a fancy belt around you that you can use to help support someone as you're going from sitting to standing or walking. Grab bars, those are very important, especially grab bars around common areas such as the toilet, in the bathroom, as well as in the shower. Those would kind of be the best things. Oh, and another thing too is making sure that you have the proper footwear. Slippers aren't necessarily the best thing for your feet. That can be a very big tripping hazard. Closed-toe shoes are the best recommendation when you are standing and walking, making sure that you're not using certain things that will put you at a risk for falling.
Right, thank you for that information. Look like there's no any question in the chat box, so I would say that concludes our our presentation today. So again, I'd like to thank once again our speaker, Jordan Fukumoto, physical therapist here at the Queens Medical Center, West Oahu, and of course to all of you, our virtual audience. At this time, I would like to ask all of you to please complete the evaluation. Information is on your screen. You can actually click the URL in the chat box, or you can simply scan the QR code to your phone to complete the evaluation. So you can scan the code on the screen, or again, click the SurveyMonkey link on the chat box. It is a brief evaluation, so we'll give you a few moments. As always, we would love to hear your feedback and comments. So again, we'll give you a few moments, and please make sure you don't log out after you complete the evaluation. Okay, everybody should be done by now. So again, the Queens West Oahu Virtual Speaking of Health series is the third Thursday of each month, same time, 12:30 to 1:30 p.m. We may be changing the time starting in October, but we will let you know in advance. So tune in for the next lecture, which will be coming to you on Thursday, September 16th. And our speaker will be our pulmonary, critical care, and sleep medicine specialist, who will be talking about sleep during the COVID-19 pandemic. And that will be Dr. Ablan, and he spoke in our Speaking of Health in the past. So I know you guys love him, so we look forward to you guys participating. And again, it's another special, excellent topic, especially during these challenging and unprecedented times. So hopefully you can join us again. So look out for the announcement, which will include registration information. We hope to see you then, and feel free to share or forward the announcement to your friends, family, colleagues, and anyone you think may be interested. So on behalf of our COO and Senior Vice President, Susan Murray, our Chief Medical Officer, Dr. Ronald Kuroda, and the entire Queens Medical Center Ohana, mahalo nui lua. Thank you very much for joining us today. Until next time, please take care and always be safe. Aloha.